Hi, my name's Amber Lockwood. I'm a Parkinson's nurse specialist. During the COVID outbreak, my clinician colleagues were redeployed from the MS team and the Parkinson's team. I therefore supported patients with both multiple sclerosis and Parkinson's disease across Fareham and Gosport and South East Hampshire via telephone and video calls so that they did not feel alone during this very difficult time. I also took on line management of our administrators that we were so very, very lucky to have.
Hello, my name is Faith. I'm a Southern Health IT Service Desk Technician. During the COVID pandemic, my work was predominantly focused on being a backline of support for my colleagues as they were working from home. So me and another staff member worked on site to be able to assist with things like sending out mobile phones and equipment, as well as trying to keep requests and tickets as updated as possible, especially as the demand for IT went through the roof during the pandemic, to basically support our colleagues where they weren't able to set up equipment, send them out, and as well as keep up requests while they were dealing with phone calls.
Hi, I'm Dean Garrett. I'm normally the head of quality improvement, but during the COVID pandemic, I was redeployed to my clinical role as a physiotherapist, and I went to work at the Holiday Inn in Eastleigh, where the NHS and social care services had taken over 50 beds for patients to spend longer in care rehabilitating before they could go home.
Hi, my name's Simon. I've been supporting staff with their incident reporting, making sure that everything is properly accounted for during COVID.
Hello, my name's Melanie Poulter and I'm the Head of Nursing and Allied Health Professionals for Petersfield and Borden. During COVID, I helped support the mobilisation of additional beds across Petersfield and Gosport War Memorial in anticipation of requiring additional support for patients and their families closer to home.
Hello, my name is Hannah Wilson. I'm a consultant clinical psychologist with the perinatal team, and throughout the pandemic my role has been to support my staff to make sure that they can continue to offer a service to the women who use the perinatal team.
Hello, my name is Paula. I'm a community mental health nurse working for older people with mental health in the community at home. During the pandemic, we've been supporting people over the telephone, also seeing people at home, initial assessments and follow-ups and urgent referrals.
Hello, my name is Vera. I'm a healthcare assistant working on outpatients department. During the pandemic, I was redeployed to a different ward to care for patients.
Hello, my name's Abby, and during the coronavirus pandemic I was redeployed for 2 months and have also been providing psychological therapy virtually to our service users.
Hello, my name's Chris Bailey. I'm the perinatal service manager. Through COVID, I think the main way we got through it was working as a close team and making sure that we looked out for each other, as well as the service users that are on our wards and in our communities.
Hi, my name is Rachel Greystock. I work for the Estates Transformation team. I cover Fareham and Gosport, Midhants and Southampton. During COVID-19, I was redeployed to Gosport War Memorial, where I supported Portsmouth and South East Hants Division on the extra bed capacity at Gosport War Memorial and as well as Woodcote Lodge. I would like to say a massive thank you to everybody that took part in those projects, right from the domestic staff right up to the senior management team. It was such an uncertain time, it was very an anxious time, but we did it together, so thank you.
Welcome back, everybody. We appear to have defeated the gremlins. We're now going to hear from our divisions and find out how their services were affected by COVID-19 and how our incredible staff kept our services running so that they could continue to provide support to all of those who needed it. If you want to ask a question about any of the clips that you're going to see next, please post them in the comments box and the service leads will be able to see them and answer them as you go along. So let's move to the next clip. Thank you.
How our services have adapted has been overwhelmingly positive over the last 3-4 months. I think we can't underestimate how proud we are of what we do, our staff, our patients, our community, and importantly, all the services that support what we do. Particularly our administration staff, our cleaning staff, our corporate services staff that were delivering meals for staff. And the reaction from everyone was overwhelmingly, what can I do and how can I help? From both our community partners and everyone I worked with. So on the whole, incredibly positive experience, but I don't think we can underestimate the emotional impact on a number of people, including our patients, particularly in our mental health services. I was very struck by the compassion, the care, the diligence, the hours that people worked, the flexibility, that they constantly came up with solutions in every circumstance. So when we had to introduce beds in pretty much every conceivable place in Lymington Hospital and Romsey Hospital, Fordingbridge Hospital, we found space, we found the equipment. We had people right at our side throughout this experience and supporting us and making sure that we did the right thing for our patients and our staff and our community. So there were lots of challenges, but overall I think we have to just thank everyone, because from the bottom of my heart, from Jeremy's heart, Rachel and Ben, we all felt overwhelmingly proud of you and what you do. And we know that every day, but it's just nice to take this opportunity to say thank you.
Just wanted a few words regarding our response to the COVID pandemic and the teams and how they have responded and stepped up to the plate. Particularly our admin teams, who had to cancel huge numbers of patients and reschedule and try to manage and still come into work. Many clinical teams, including the MSK services, physio, orthopedic choice, pain, podiatry, that had to stop services altogether and get redeployed into either community teams or on wards in many instances. And this goes for the Falls team and for endoscopy and various nurses and clinicians. It is amazing how everybody responded to what they needed to do. Services like radiology managed to continue throughout despite the pandemic, which is amazing. Our outpatient nursing staff has been managing people at the doors of hospitals and our estates teams as well. For me, it is a huge, big achievement what everybody's managed to do. Finding spaces for beds that we didn't even know we had, working with other providers, UHS, Solent, PHL, to really make the best use of all our facilities, all our clinical experience and all our expertise to make it safe for our patients. And I'd like to say thank you to everybody who has been involved. Thank you very much.
To say the last few months has been particularly challenging would be an understatement for everybody, I'm sure. However, having such a diverse range of services and such key services to deliver, being able to rely on staff to really go the extra mile and support people who are the most vulnerable people in our communities in a professional and exemplary way has been a delight to witness. We've had to make lots of adaptations, so lots of working from home via information technology that was unfamiliar at the start of the pandemic and is now business as usual. to ensure that testing for our patients was available at the very beginning when we had a lockdown of services in our most acute settings. So I would just like to say a huge thank you to everybody who has been absolutely fantastic within the division and worked tirelessly with compassion, professionalism and good humour. Thank you.
I wanted to say a really huge thank you to all our staff. One of the big things that hit me when the crisis started was this is a really big division, there's so much complexity, and is everyone going to be able to rise up and do all the things they need to do? And they absolutely did. I couldn't be more pleased with how everybody behaved and stood up to the challenge and got on with things. I think particularly I wanted to mention adult forensic services, because I know there's been a lot of discussion from other people about the other services. But in adult forensic services we had outbreaks of infection in 2 of our services, and the staff are absolutely amazing. They got on and they provided the service, they undertook all the roles they needed to do with PPE and looking after patients and protecting them in quite challenging circumstances, and the infection was ultimately eliminated and people were well and well looked after, and the staff were just brilliant, so thank you.
Over the last few months you may have recalled there's something called COVID-19 that's come into all of our lives, and it has presented some challenges, but it's presented some real opportunities. The teams across Learning Disability Services have embraced and utilised electronic systems that maybe they wouldn't have done before. Really engaged service users who sometimes find it difficult to engage in different mediums and maybe sometimes face-to-face in electronic systems. They've required support from carers in their homes and families in their homes. So there's a big thank you to them as well about helping us engage with those service users. It's really important that we kept in touch. This is a vulnerable group. They have a multitude of physical health and other emotional and mental health issues. So to keep in touch with those guys, which we have consistently, has been really important. So I think what I'd really like to say across Learning Disability Services and to the NHS, thank you so much for everything you've done during this time.
During coronavirus, it's been a really difficult time for CAMHS units, for the young people and staff. I think it was difficult getting used to all the new restrictions that came in around social distancing and having to wear masks. The particular difficulties for us were around changing the visitors policy and not allowing parents to come onto site or into the building, and of course for young people that's really challenging, and for parents it's very challenging too. So I think during that time it was particularly difficult for them, and I think we managed it as well as we could at that point, and I think the young people worked really hard as well to try and get through it, and they were really understanding, and the visitors and parents were really understanding as well. I think for the staff, they took on a lot of changes in a really short amount of time and really worked with it and just accepted everything that we threw at them, and really changing the way they worked completely in every way, from how we dressed to how we interacted with the young people. It was completely different to anything that we'd done before, and I think they did amazingly at it. And I think we're kind of coming through it now. They're bringing back a lot of the things we had before and getting a little bit more normal again. And I wanted to obviously say thank you really to all of the staff who have worked so hard to try and get us through this challenging time and continuing to give that high level of care that we've always given to young people within CAMHS. So thank you everybody.
Well, what an exciting time we've had over the last 4 or 5 months. We started off in April being told by Public Health England that we needed to stand our services down. As you can imagine, that was really challenging for our staff. We wondered what were going to happen to the children and families of Hampshire. However, we very quickly realised the reason for it was that they wanted to redeploy our staff. We have really highly skilled, very well qualified public health staff. We're in the pandemic and it clearly needed a public health response. So our staff absolutely stepped up to the mark. Those of them who were able to volunteered, they used their skills, their knowledge, they upskilled as well, and they went off to work in other parts of our services who really needed them. They had a really interesting time. I think some of them had a really challenging time, but we all learnt, and they learnt a lot from it. They really were amazing. What was more amazing was the response from those people who didn't go and do that for whatever reason. They were shielding at home or they were working in the office at base, because even though we were asked to stand our services down, we very quickly realised that the redeployment wasn't going to take all our staff. We needed to make sure our children and families in Hampshire got the support they deserved during this really challenging time. Can you imagine what it must be like to be a young mum and to be pregnant? To have your baby without the support of your partner. That happened to some of our mums in Hampshire. It happened to some of our families. Can you imagine as a dad not being able to be there for your partner? We know that was difficult. We experienced that for ourselves within some of our services, some of our own staff who are service users, but also our staff made sure they were there on the phone or with the use of Visionable. Wow, how much we've all learnt about digital offer, digital strategy, and how to use Zoom, how to use MS Teams, and even how to use the phone properly to do an assessment with a young toddler. So we've had a really interesting COVID period. It's been very challenging for our staff. At the same time, we've been mobilising our 3 new contracts. I'm really proud to say that our division has absolutely stepped up. Our staff have been amazing, and I'm really proud of them all.
One of the challenges we faced during COVID was sensory overload. We had information coming from everywhere. There was national and regional profiling saying that the North and Mid Hampshire were going to be hit hard and fast with COVID. There were requests from the system saying you need to increase your beds. In physical health, they wanted our 18 beds to go up to 30, 40, then 70, and we did that. The head of nursing and head of ops, they got a team together and they made sure that there would be beds for people when they came through. We were also asked to have a mental health ward for COVID patients, and the team got ready, again, head of nursing Richard and the matron Chris, they got together and they made that happen, and they delivered and built that ward from the bottom up, and it was ready to go. We were also asked to produce a field hospital, and that was something we had never done before. So our project team, Vicky and Sasha, they prepared, they drew it on a whiteboard, and they were ready to deliver. It was incredible what we achieved. One of my greatest anxieties was infection control, making sure that all our staff and patients were safe. And we had incredible support from the Trust and from Jackie Hunt in infection control. We're really, really grateful to them. But for me, some of the unsung heroes are the community staff. We spent a lot of time focusing on inpatients, and it's quite right that we did. But the community staff put their plastic on over their uniform, and they went into houses, and sometimes those houses had heating on those hottest days of the summer. They're the unsung heroes. But to all frontline staff and all our corporate partners, thank you.
I think our COVID journey started around April, March time this year when we saw that it was going to be quite an impact to us on the system. Our initial was a reactive response around how we were going to help support patients in the community to keep those vital services going, but also how we were going to increase our beds on Anstey Ward, our community hospital, to support the step down from Hampshire hospitals around COVID patients that needed that rehab. So we initially did a scoping exercise to look at how we were going to increase those beds, and we went from an 18-bedded unit to 2 wards and up to 75 beds. Now thankfully we didn't need that within the Mid and North, and we kept the beds at 35 just for subacute medical care and COVID step down. The ward has now since gone to a 28-bedded unit looking at rehab. The ward team have been through a massive transformation around all of those changes that we had to adapt to around PPE, changing guidance in that, as well as the changes of patients that we had through. So we were seeing a younger cohort of patients for rehab, which the team haven't normally been used to, and they've done really well in coping with that. We've also had huge support from outside services such as MSK physios and school nurses and health visitors to be redeployed to our ward to help increase the staff that we needed. Our community teams have been through a huge journey as well, with our specialist nurses, community nurses and therapists really wrapping their services around the patients. But also we've had a real opportunity to work with our outside partners, such as Hampshire Hospitals and primary care networks, to really work as one team. And the teams have been for a real transformational journey around creating that one team model and making sure that the right person is seeing the patients in the environment that they need. Without all the support from all the teams and all the staff, I don't think we'd be on the transformational journey that we are today, and I just want to say a massive thank you to everyone.
The last few months has been a really challenging but also really hope-instilling time in the city. I've never seen so many people rise to the challenge of delivering care in new, dynamic, flexible ways and making sure that we put our patients at the heart of everything that we do. I've been really impressed in a couple of places in particular, such as our community care, how we've managed to make sure that people receive care when they need it, how they need it, but also adapting to the fact that we've not been able to see them face to face, how staff have adapted to virtual technology, and how people have embraced that and have made a real difference in our patients' lives. The other area where I think we've done a fantastic job is working alongside other parts of the wider healthcare system in Southampton to deliver a particularly good crisis response. We've worked well with the Acute Trust at Southampton General, with our council colleagues, and with Solent, the other trust who run community services in the city, to really form the beating heart of the city and make sure that people have got the care as and when they've needed. Our staff have been so fantastic, working in new ways, in new places, and delivering care in all sorts of different ways that we would never have expected 6 months ago. It's been really, really, truly humbling to be a part of that.
When I think about what's happened over the last 2 months, I have to take a breath and be really proud and impressed of everything that has been achieved by the teams. They've been absolutely outstanding. Every challenge that they've faced, they've delivered against. There's been significant changes asked of them in their roles, in the times that they work, and just generally how they go about doing things. And they've risen to the challenge every single time. I'm so proud of all of our staff. And there are so many things that I'd like to talk to you about that they've done. Some of the key areas they've focused on is around supporting the system. One of the big things that we knew we needed to do was help manage patients' flow out of the hospital and support people to be at home. The teams have worked incredibly well in physical health and mental health services to think of new and innovative ways to engage with our patients and service users, to ensure that they're safe, the most vulnerable are being cared for. They've gone above and beyond on all levels. So I just want to take this opportunity to say a heartfelt thank you to everybody across our physical health services, our mental health services, our corporate teams. I'm sure I haven't mentioned everybody and I apologise for that, but each and every one of you have been absolutely amazing and you make us so proud and you've done so much for all of our community. So as I say, a heartfelt thank you from all of us at the division in the Portsmouth and South East Hampshire.
That was just so lovely to hear how our staff have really pulled together. I hope you all enjoyed it. But it's not just our clinical and support teams within our divisions that had to adapt. Our corporate teams have adapted their services too to offer incredible support to our divisions. So let's see what they've been up to.
During COVID, we have been involved in raising funds for the charity. We have had funding coming in via donations from Just Giving website and also from grants from NHS Charities Together. And I'm delighted to say that through those sources we have raised over £150,000. Some of that money has already been utilised in providing wellbeing items to patients and service users and to staff throughout the Trust. I cannot end this without saying a tremendous thank you for all the support that we have received, not only during COVID, but during the current year, and look forward to your future support in years to come.
During this time of COVID-19, we have recruited something like 83 new volunteers from around Hampshire. And our volunteers have mainly been working in the delivery of personal protection equipment, PPE. They've also been delivering goods, making face masks, working in IT, doing a variety of jobs. And we've also benefited immensely from companies around Hampshire who have helped us with removals of equipment, heavy equipment, delivery of goods again. So we've been working with removal companies, housing associations, and staff who've been furloughed from a tiling company. So we've altogether used well over 100 people, good people, lovely people from Hampshire who've helped us during this time. One thing that we have enjoyed as well is the work of so many people in Hampshire who work for various little organisations and associations around the county, who have been phoning people in their isolation, shopping, keeping in touch, driving people to appointments. We've been immensely grateful for the help of so many people. Finally, I'd just like to say a great thank you to a wonderful team who have helped us recruit so many people, and the wonderful generosity of so many around Hampshire has been so encouraging and so immensely beneficial to those whom we serve and support.
Hi, I'm Robert Cragg. I'm Deputy Director of Inclusion and Organisational Development here at Southern Health. Just delighted to tell you about some of the brilliant impact that the workforce team had during the COVID pandemic. So first off, I'd just like to thank our training team in Leeds. So they delivered 3,000 face-to-face trainings of essential skills and competencies during the lockdown period, as well as helping sustain 12,000 learning contacts online. They also supported 146 students to work in our clinical environments during this period, which was a really big undertaking. We also were able to provide all of our e-learning materials out into hospices and wider health and social care providers, helping them learn and stay safe. We also received some brilliant help from further afields in the form of bowling alleys in Alton and Lymington that enabled us to train staff in a socially distanced manner that some of our premises don't permit, so thank you to them. And we also brought in people with one-stop inductions so that they gained all the clinical competencies they need before they went to the front line, rather than having to learn them on the job, which is usually the instance. Our people development team were also really well utilised during this period, so they set up a listening service for our staff called Listening Ear. That took 100 calls dealing with things from social isolation, loneliness, all the way through to anxiety about the predicaments that they were facing in the working environment. We also set up a health and wellbeing hub which has been accessed by 3,000 individual staff during that period, which has helped them sustain their resilience and seek support and be signposted to essential psychological advantage support. We also set up risk assessments for staff, both on an individual level and also at premises, making sure that people felt individually safe and that our premises were safe for both patients, staff and the public. A huge undertaking was also taken by our HR team, who did a huge piece of work around bringing people in essentially in that time, and they brought in 229 people, and it took the people an average day from recruitment to starting was only 11 days, which is a really big undertaking with all the checks and balances that had to go into place. HR did a brilliant role in supporting all of our shielded staff who were unable to come into work during that period. They helped out redeploy people from department to department to make sure that our skills were best utilised during the pandemic, and they were also pivotal in leading our Gold Command. So a massive thanks to all our Workforce Directorate colleagues.
During the COVID crisis, communications has been a hugely important part of how we support our staff and our patients and the public to understand what's happening, what's going on, lots of changes in the way that we're working. New guidance being released all the time, and it's been really hard for everyone to keep on top of that. So as a communications team, right from the start, we really changed the way we worked completely. We went to sort of 7-day working. We put out daily updates to staff about what was happening. We did a huge amount to inform the public and make sure that the really important messages about stay at home were being communicated. We worked with the media to get really good stories out about how to look after yourself during lockdown, how to look after your mental health, and the fact that our services are still around. So a huge amount of work there. But really, we prioritised our staff and how we were communicating with them. We developed new technologies. We used things like Facebook, social media, videos, and lots of other methods to keep our staff informed and aware about what was happening. As well as what was happening, also how we could all look after our well-being, recognising how challenging it's been. So I just really wanted to say a huge thank you to the communications team for everything that they've done and are continuing to do. And also to all of our staff, really. It's been the most incredibly challenging time, and you've all done an incredible job. And I'm humbled to be part of a team that supports you guys doing what you're doing. So thank you very much.
What has technology been up to and IT? Well, we've enabled most of the staff to work remotely, brought in a whole new series of initiatives to enable digital working, new mobile devices, working from home and that kind of thing. We've also increased the accessibility of our IT support services by online initiatives, creating phone call handling systems so the staff can work from home remotely in line with the government guidelines. We've also had an explosion of uptake of digital technologies, and this has created digital leads and a digital champions network out throughout Southern Health, which basically has allowed us to create an information flow and understand what the demand is from our user base. In terms of patient-facing initiatives that we've conducted, video appointments have absolutely exploded. We went from about 20 appointments a week back in March to over 1,500 appointments a week at the moment. And they're great. They allow patients ease of access to our service. They reduce our carbon footprint in terms of decreasing travel costs, and they allow clinical contact with our patients in line again with government guidelines. We also introduced a new Rio mobile system. So Rio is our electronic patient record system, and this new system allows a tablet device to allow on-the-fly record keeping to be undertaken really easily in patients' homes, and it's actually improved the amount of, or decreased the amount of time taken for record keeping, which has allowed our clinicians greater time to care, and we're now looking at rolling that out on a much larger system. So I'd like to say a huge thank you, not just to my team who've worked incredibly hard in technology over the last 4 or 5 months, but to the entire shift staff. Getting through Corona pandemic would not have been possible without the contributions of all of our staff helping us through these difficult times.
Within Estate, we are responsible for maintenance, capital programming, domestic services, transformation and catering. I just wanted to take this opportunity to say how much I really appreciated all the support from my team, and a big huge thank you to all of them for working so hard during the COVID pandemic period. We developed plans in the early stages to increase bed capacity by 670 beds. We also reshaped some of the estate and laid 852 metres squared of new flooring, and we supported the creation of PPE and PPE hubs, and some of our people actually became PPE drivers, delivering PPE supplies to the frontline staff. We also increased our cleaning hours and arranged temporary storage. Finally, my amazing team managed to source 7,000 additional ready meals per week, and from the aviation sector, 32,000 snacks were made available for staff. None of this would have been possible without your support. So a really big thank you from me. Thank you.
I've got a few teams, corporate teams, who have supported during COVID and had their own challenges to deal with. Clearly finance sits with me, and the team have been incredible, led by Kim. They've done everything they could to support staff and patients during this time. We've obviously needed to keep the money rolling, we've needed to pay suppliers on time, we've needed to ease the burden of budget managers, and they've done that so well. They've been first in the queue if something's needed to be delivered. Some of the team were out delivering staff meals, as I recall. So they've done an incredible job, and it's one of the busiest times of the year for our team. The procurement team are also one of mine, and they've been led by Fiona during this time. And she's done an incredible job. The ask for procurement
from almost nothing, just normal business as usual, to having to cope with, for example, PPE or opening up 300 new beds and all of the supplies that we needed for that, was an incredible journey, I suppose. Over a period of probably a week, we went from almost nothing to realising how much needed to be done. The volume of PPE that's coming into the trust that needs its own, effectively its own supply chain, had to be set up from scratch, and I'm really grateful to everybody that stepped into support from that from other teams. Our business planning and performance team and the guys that work with contracts, all led by Sue. In some cases, we're able to redeploy directly into the divisions, and that was really important because we wanted to ensure that as many people were sat within the divisions supporting where they knew they needed help the most. And I'm really grateful to that whole team for everything they did to flex around the business requirement during COVID. So finally, thanks to everyone. Thanks for every little thing you did, whether it was being a safe pair of hands that stayed on finance or whether it was the person that was redeployed into a team that needed the help more. I'm really grateful for everything you did, and you did an amazing job. Thank you.
I hope you all enjoyed that. Another opportunity to see how our staff have all pulled together. In a trust as big as this, it's not been possible for us to have a video for every single team. But I just want to say a huge thank you to everybody for the way that they've pulled together and changed and adapted during the COVID-19 pandemic. Our next clip is very interesting in terms of relating back to what Paul Draycott talked to us about earlier, about some of his proudest moments. And supporting our Black, Asian and minority ethnic staff has been a major piece of work in this year. Started back in November, long before COVID, when we started to look at the progress of our staff and the experiences of our staff through this organisation. And as COVID moved through and our staff had to deal with some very complex issues at a personal level and a professional level, we had to make sure, as Paul said earlier, that we'd done the proper risk assessments and put the proper supports in place for our staff. So we're going to have a look at a clip now from those staff to see what support we put in place during the COVID-19 experience.
It is our priority and necessity here at Southern Health that all Black, Asian and minority ethnic staff absolutely feel supported and celebrated for who they are. We wish for them to feel that they have equal opportunity to progress, to fulfil their career ambitions. We really wish for them to feel that they work in an organisation that does not tolerate discrimination, harassment or bullying of any kind. We really want them to feel supported by allies. We really want them to feel that we are tackling the subconscious biases that they receive in our workplace. We really want them to feel that they work as a diverse workforce that is representative of the diversity that's in our wider community. And above all, we wish for them to feel included, engaged, impassioned in everything we do as an equal member of our Southern Health family.
Hi, my name's Simon. I think Southern Health has supported me and us by accepting that there's a problem to start with. It's looked at the data, it's looked at national and local data, it's seen that there's a problem, and it's opened itself up to the change to overcome those differences.
Hi there, I'm Sam Mojo. I'm the manager of Trinity Ward in Antelope House, Southampton. So Southern Health has supported me by offering the COVID kind of BAME risk assessments. So I found that quite helpful because again it highlights the risks that are faced particularly by BAME individuals. So I think I found that very supportful and helpful. The VoxBox group as well that I've been running, and the BAME forum, which again has been very, very helpful and supportive of not only myself but also being a manager of BAME staff.
Hello, my name is Alia Gomez. I'm a practice development nurse. I think the Trust has been very responsive to the data that has come out in line with those inequalities and has put in measures via the risk assessment and conversations. It had deep conversations about how we're going to address these issues, which I found very helpful.
They've created the new cause groups for bullying, harassment and hate crimes. And they're supporting staff on how to report those. They're not scared of having extra figures. They're not scared of the extra numbers. They want an honest view of what's happening within our trust.
It's been done in a way that highlights the risks without sort of making people feel really uncomfortable or where the spotlight isn't shown too much on them. Because again, that can make people feel a bit uncomfortable if there is a bit too much attention being brought to them because you're from an African background or Asian background. We need to do all of this. That I've been told that can be, if that's done sort of a bit too intensely, that can make people feel very awkward around their colleagues. So I think it's been done to the right sort of level.
We are in it together, and we're not all experiencing it in the same way. At the moment, our BAME colleagues need our compassion and our support much more because they are at higher risk. And if we can care for each other, then we can better help the communities we serve.
I hope you enjoyed that. You may remember earlier when Paula Hull came up to answer some questions, and she talked about the things that she was most proud of. One of the areas she mentioned was the support that we've been offering to our carers and working very closely with them to improve the offer that we make to them. And one of our incredible carers, Leslie Brinkman, shares her honest experience of what it's like to be a carer for someone being cared for by the Trust in this next clip.
Hello, my name's Dawn and I'm Head of Patient and Public Engagement and Patient Experience. Part of my role is to ensure that our carers and their family have a good experience when they come into contact with our services. Southern Health has made a commitment and pledge to carers. We want to listen to them, support them and give them a voice. We're working really hard to improve the way we listen to and communicate with our carers, and we want to give them opportunities for greater involvement. And of course, most importantly, we want to look after the health and well-being of our carers as well as our patients.
Hello, my name's Adrian Thorne. I'm an appointed governor for Carers Together, and I've been a governor with Southern Health since 2016. As an appointed governor, I have a specific interest in the way in which the Trust supports carers. Southern Health support to carers is not as good as it should be, and I think as a Trust we recognise that, and it is recognised right away across the Trust. The charities support carers very, very strongly within the county. What we need really is more of a partnership between Southern and all the charities that support carers within the county.
Well, it started, I'm surprised to say, all of over 14 years ago. We stepped off a plane from Australia after a once-in-a-lifetime trip and had no idea what was going to face us at home. When we got back, we found our daughter there. She'd come down from London, and a full crisis team trying to support our son, who'd apparently had a first episode of psychosis. We knew nothing about mental health, and we've been trying to learn ever since. So those first days, I can't thank the crisis team enough, and even more, I cannot thank the early intervention team. That was just kicking off in Hampshire. Our son fulfilled the criteria, and they kept him on an extra year, 4 years, to support him to finish his postgraduate studies and therefore qualify him for the career he had always wanted in architecture. So that initial touchdown with Southern Health was relatively positive. And then I don't know exactly what triggered it, but there was a period of not taking medication. And the crisis team were back on the doorstep, supporting as best they could. And very sadly, I can still see the conversation now in which they were so concerned about him. They were talking about a mental health assessment. We weren't sure what that meant at the time, but they were talking about a mental health assessment and warned us that it would be very traumatic for him and very traumatic for the family, which it proved to be. And he was taken into hospital as a voluntary patient. That lasted overnight. He rang me the next day to tell me that he couldn't come home, he didn't know why he was there, and then phoned me again to tell me that I think that they had to restrain him and use a depot injection. And that kind of changed the whole scenario. And there have been, including now, 5 sectionings. And we began to understand the meaning of a revolving door patient. And that saddened us a lot. He hasn't worked for a long time, obviously, and his condition has not improved. And sadly, I now see a young man who has been locked up this November for 3 years. None of us imagined, I don't think staff thought it would come to this. And I have to admit that COVID has not helped that for the last, since the lockdown. And of course, he's very, very anxious about his future. How he is ever going to get a life, get on the property ladder. All he wants are a couple of children, a wife, and a successful career. And that doesn't seem a massive amount to ask for most people. But for him, as he openly admits, is one hell of a mountain to climb ahead of him. I've made a positive move in the last couple of years. I was privileged and asked to speak in various things to do with Southern Health. And I had a sort of light bulb moment when I thought, do you know what? I can keep bleating on to friends, bore carers rigid with how this isn't worked and that communication isn't good and that member of staff, why didn't they retire earlier? But actually, I want to help change things in Southern Health. So I kind of got involved with the families group. I've been on quality improvement workshops, and I've made a lot of friends as carers and service users and staff, and it does make me feel that I'm trying to do something, not just for my son, but for everybody that follows him through the service, because I think we need a holistic approach and we need compassionate mental health. I would say they, and I don't know the ins and outs of their working day, but I would say they probably, I'm talking rather about acute units rather than the community teams, but they all have very high caseloads, very difficult circumstances still at the moment, and we know that resources have been cut back and cut back and cut back.
there is obviously the very big issue about confidentiality, and we hear about common sense confidentiality. In the early days, we did suffer, and I understand totally when I hear carers talk about the difficulty, oh, they won't tell me anything, etc. But I've also met amazing staff who have put their jobs on the line to use their common sense, and I felt that our predecessor here, the CEO who was here, did very much. I'd say to all the staff, if they saw it, the buck stops here. We support you. And the very first QI workshop I went on, I was aware, because I was suddenly with staff from an acute unit, who I realised were terrified of disciplinary action or losing their jobs. But when you've got very stressed carers of all walks of life, at all stages of somebody's mental health journey, then you really do need to treat them with compassion, assure them that they can give all the information to you in the world, they can talk to you generally about medication or whatever, and reassure carers that actually they do matter, they are important, they can help their loved one's recovery, however long that takes, however many sectionings it takes. They're very, very important. And I think as hard as it is for them, somehow they've got to get over those barriers and just put themselves out there. And I think the most important thing in that aspect is, how many of them have ever been asked or asked themselves the question, if that was my relative, how would I feel? If that was my relative, what would I want for them? I hope to see them recognised, treated with respect. Some people have spoken as if that doesn't always happen. And I think on my wish list, what I would like to see if my relative goes back into hospital in the future, I would want to be contacted within about 48 hours, if that's a phone call, if I'm actually able to go to a unit or whatever, somebody to recognise me, point me, signpost me to who that carer lead might be, that named person, and I need a phone number or an email address, and I need phone numbers, particularly if it's in the community. Perhaps I need definitely phone numbers or contact information. If this crisis happens on Friday, fine, you phone us here, you phone this number, and somebody will respond. And you know that you've got some reassurance. I think reassurance is a big word. I think building carers' confidence is another aspect that's important. So I think all those things are totally achievable with training, the right people in post, and the trust investing in those staff to deliver what's required and to move everything forward. This has been a long time coming. We know the triangle of care, which is now going to be invested in full tilt, we hope. It's been around a long time. It's been around since 2010. So, I hope we're not teaching our dogs new tricks. We need this now. We've needed it a long time before. But, you can't live in the past. The important thing is, where are we going? What are we all trying to achieve? And I'm very much on board with that. And I'm very happy to support the trust. But I also need to make sure that I'm ready to criticise them when I think, constructively, when I think, actually, do you know what? You're not up to the mark and you're not actually doing the job that we need you to do. I want this to become an outstanding trust. And I don't see why it can't if it puts its money in the right place and its resources and backs its staff to the hilt.
We know that it's been a particularly difficult time for our carers and family over the past few months. We've spoken to a number of carers who've identified a number of issues. We've already put additional resources into this work, and we've now co-produced a comprehensive plan to address all the issues that have been identified. If you're a carer or you know a carer or family friend and you'd like to be more involved in our work, please do contact us. We'd love to hear from you.
I hope you enjoyed that. Look, it's 5 to 8, and so we have one more clip left. And so please stick with us and stay with us until the end. The next clip, I'm honoured to introduce which is The Depth of Me. It's a partnership between Hampshire Cultural Trust and Southern Health NHS Foundation Trust. This is a project where our patients and carers have created their own photography and poetry to give a powerful voice to patients and their experiences. You can view the full documentary by visiting our webpage, but in the meantime, here's a sneaky peek at this amazing and breathtaking exhibition.
So, Depth of Me, where did it come from?
And I'd give up forever to touch you, 'cause I know that you feel me somehow. You're the closest to heaven that I'll ever be, and I don't wanna go home right now. And all I can taste is this moment, and all I can breathe is your life. And sooner or later it's over. I just don't wanna miss you tonight. And I don't want the world to see me, 'cause I don't think that they'd understand. And when everything's meant to be broken, I just want you to know who I am.
At that last session, it was wonderful when I was talking to a participant who I'd met at the beginning, and she was really nervous and didn't think that she had anything to bring to the group. And then we were talking at the end, and she was just like, it's just wonderful, it's just wonderful. Most of my time, it feels like it's all about pills and appointments. And this has been about healing me and me being me. And it was just one of those moments that you go, that's why there should always be more of these things. And that's just, it's such a special moment. It was lovely.
I don't think they'd understand. But
So now is the time for us to close this year's annual members meeting. What I would like to do is just take a second to thank Dr. Nick Broughton for his time with us as the Chief Executive, who did a fantastic job and has moved on to Oxford and will be doing a fantastic job there. But we owe him a huge, big thank you for everything he's done. One other thank you I would like to make is to Natalie Duffy, who has organised this event, and it has been phenomenal. She's worked so hard, so thank you, Natalie. So we're going to go to a final clip, and after that clip, we're going to be taking the mute off so that we can have one last clap for all of our staff. But on behalf of the board and myself, we would like to say a huge thank you to you, our staff. So we'll watch the clip and then we'll all clap together. Thank you and good night.
A huge thank you to you all.
A massive thank you to all our staff and partners from me to you.
A huge thank you to you all.
Just want to say a huge, fantastic thank you to all my team and all the colleagues that I worked with.
Hello, I'd like to say a huge thank you to you all.
Just like to say thank you to the InReach team, Enhanced Recovery and CRT and my colleague Becky.
A huge thank you to you all.
I would like to say a big thanks to my colleague to support everyone to keep safe during this difficult for everyone time.
A huge thank you to you all.
And thanks to everybody that helped maintain our service and all my staff who were brilliant.
And thank you to all the staff at Southern Health, all the NHS, nurses, everybody.
Thank you.
I would just like to say a massive thank you to all of the staff and all of the management that helped get us through these times.
A huge thank you to you all.
Thank you everybody for your fantastic work during this time. I'm very proud of you.
Thank you to you all.
Just want to provide a massive thank you to all my teams for all the hard work that they did through the coronavirus pandemic, for coming into work, for their commitment to the patients. A huge thank you for the ongoing work that you're doing.
Can I just say to the NHS a massive thank you?
I'm really pleased to have the chance to say a massive thank you to the medical staff within the South West Division.
Thank you to everybody in Antelope House, but in particular Trinity Ward. A bit biased in that, but they've been great. They've been wonderful, and they've continued really to work very, very hard in showing their commitment throughout this very difficult time. So thanks everyone.
Thank you.
I just want to say a huge thanks to everybody for their hard work and dedication.
Thank you.
Thank you to you, each and every one of you.
Thank you everyone.
Hi, I'm Beth and this is Biscuit, and you all know us so well. I want to say a massive thank you to all the staff behind the scenes that have worked incredibly hard to ensure that our staff get meals, that our users get the things they need while being kept in hospital while COVID's been going on. I can't thank you enough for all the hard work that you've done, and I look forward to working with you all again and seeing you all again in the future. Cheers guys.
I'd like to say a huge thank you to our team lead, clinical team lead, and the rest of my team for being such a great support during COVID-19.
I want to say a huge thank you to everyone in our huge division. Thank you.
And a huge thank you to you all.
A big thank you to the team. The team have been absolutely fantastic.
Thank you everybody.
I'd like to say a massive thank you to all the staff, young people and families, for being so understanding.
I want to say a big thank you to all the staff in the community. So it's a big thank you from me.
A huge thank you to everyone.
I'd just like to say a huge thanks to the IT team, particularly over the last 6 months during the COVID-19 pandemic, when I reckon they've probably delivered about 8 months worth of work in about 8 weeks. Thanks very much guys, you've been great.
A huge thank you to you all.
I'd just like to say a massive thank you to everyone who has made sure that we've delivered care over the last 6 months. Thank you all so much.
Just want to say thank you to everyone that's helped us.
And I want to just give a massive thank you to all of the staff.
And I would just like to say a huge thank you to everyone.
Just like to say a big thank you to all the team.
Thank you. I would like to thank my team and the NHS very much for supporting me for all this.
I'd like to thank the whole NHS, but particularly our team, because we all came together, we all worked really, really hard, and we all co-supported each other, so thank you.
Just like to say a massive thank you to everybody.
Thank you so much to all our staff. You truly are amazing. Well done.
Thanks to everyone
everyone for all your help. You've been amazing and we deserve a big celebration.